My name's Brendan McGrath. I'm an intensive care consultant working in Manchester. I've always been a coalface bedside clinician and always had an interest in research, but I always thought that research was something that was done by somebody else. But increasingly, I wanted to ask my own questions, and over the last 5 years I found myself getting more involved in research and using the resources that are available to me in the region and then nationally. And I've ended up now having just completed a PhD, now with about half of my job is spent running my own studies, networking with colleagues, researchers, patients, staff, to answer some of these questions that are really important to me. So I'd very much encourage you, if you're thinking about research, go and explore what resources are available to you.
So my name's Hugo Wilson. I'm a GP, a partner in Sussex, also a programme director and an appraiser, and I'm involved in research. So my advice to a new practice considering starting research would be to probably talk to your research network to find out their tips, hints and tips, but also to talk to an established local practice that's involved in research, because they would also have some good hints and ideas about how to get started.
Hello, my name is Claire Cox. I'm a senior research nurse for the Clinical Research Network in Kent, Surrey and Sussex. Myself and a team of experienced primary care research nurses and facilitators support GP practices being or becoming research active. This specifically includes enabling practice nurses, health practitioners and healthcare assistants to take on the role or some aspects of the role of the research nurse. Why is having nurses involved important? We know research is most successful where there are nurses in practice with this role alongside a key administrator and a GP as principal investigator. I think the key elements in order to be successful in this role are a belief that clinical research will make a difference, having the passion and confidence to deliver research and to influence others' experiences so that they feel the same way.
So my name's Adam Galloway. I'm a children's physio at Leeds Children's Hospital, and I've also got one of the NIHR ICA pre-doctoral clinical academic fellowships. So my top tips for anyone considering getting involved with the ICA programme is, first off, do it. The key tips that I would give anybody is make sure you've got a supportive team, both in your clinical setting and academically. Don't rush an application just to get them in. Try and find the supervisory team that's going to help you make sure that your application is the best it can be. Make sure the project is yours, make sure it's something that you love and you don't mind doing even when it gets tough, because that's what's going to be the difference. And the other key tip is make sure that you definitely have a real life outside of clinical academic life as well to keep you sane.